Every 6 minutes, an older adult suffers a stroke that could have been prevented, and behind that shocking statistic lies a life interrupted, a loved one no longer sharing precious moments. Rodrigo, the grandfather who won't stroll in the garden again. Maria, the grandmother who no longer tells her evening stories. A new investigation shows that 4 common medications can triple the risk of stroke in those over 60, and many are likely on your own shelf. As a specialist in aging health, here's what you need to know to protect your brain and manage your treatment safely. The first group involves over-the-counter non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen and naproxen. Although highly effective at relieving pain and inflammation, long-term use can raise blood pressure and impair endothelial function in brain arteries, increasing the risk of blockages, according to studies from Harvard Medical School. Unsupervised continuous use can overburden the kidneys and disrupt electrolytes, triggering imbalances that favor clot formation. Second are atypical antipsychotics, commonly prescribed for mood or behavioral disorders in dementia patients. These drugs disrupt body temperature regulation and affect cerebral blood pressure, raising the risk of thrombotic stroke, as evidenced by research from the American Academy of Neurology. In many older adults, these medications remain active for extended periods, worsening inflammatory processes. The third culprit is thiazide diuretics, used to control blood pressure. By promoting sodium and water excretion, they can cause electrolyte imbalances. Without continuous monitoring of blood potassium and sodium, arrhythmia risk increases, potentially leading to stroke. According to a Journal of Hypertension study, dehydration tendency in those with lower body water reserves further exacerbates the issue. Finally, some oral anti-diabetics in the sulfonylurea class prescribed to lower blood sugar can trigger insulin spikes and unrecognized hypoglycemic episodes that activate coagulation pathways and alter cerebral vessel caliber. A European Diabetes Association study found a significant increase in ischemic stroke risk among long-term sulfonylurea users. Given these data, the most important step is never to stop your medications on your own. Schedule a discussion with your doctor to review each drug, explore safer alternatives, and adjust dosages to your risk profile. For chronic pain, consider replacing NSAIDs with controlled dose acetaminophen, or investing in therapies like physical therapy, low-impact exercise, and myofascial release techniques. If you're on antipsychotics for behavioral control, seek a multidisciplinary approach involving occupational therapy, cognitive stimulation programs, and, whenever possible, gradual tapering under medical supervision. For hypertension, evaluate options like angiotensin converting enzyme inhibitors, which have a more favorable vascular profile and proven ability to protect cerebral arterial endothelium. For diabetes, discuss with your endocrinologist transitioning to SGLT2 inhibitors or GLP-1 receptor agonists, which not only regulate blood sugar but also offer cardiovascular benefits and reduce systemic inflammatory markers. Concurrently, it's crucial to maintain strict blood pressure and lipid control. Beyond medication review, other puzzle pieces are vital to stroke prevention. A diet rich in fruits, vegetables, legumes, whole grains, and monounsaturated and polyunsaturated fats strengthens the vascular system, preventing oxidative stress. Daily omega-3 sources such as fatty fish or chia seeds promote blood fluidity and regulate coagulation mechanisms. Regular moderate exercise like brisk walking, swimming, or cycling for at least 30 minutes most days improves cerebral circulation, reduces arterial stiffness, and aids hormonal balance. Strength and stretching exercises increase vessel resilience, and support the central nervous system. Manage your stress through techniques such as meditation, diaphragmatic breathing, or yoga, because chronically elevated cortisol promotes endothelial dysfunction and chronic inflammation. Maintain a healthy sleep routine by reducing screen exposure before bed and ensuring at least 7 hours of restorative rest. All these measures work in synergy with optimized medication management, creating a solid barrier against stroke risk. In summary, review your medications with your doctor, explore more modern and safer therapeutic alternatives, and reinforce your daily life with a balanced diet, regular exercise, stress management, and quality sleep. In this way, you turn information into prevention and take the lead in your own brain health and active longevity. Imagine your brain as a vibrant city where the houses are your neurons and the roads are the arteries that deliver oxygen and nutrients to every corner. A stroke occurs when traffic suddenly stops on one of these routes. There are two main types: ischemic, the most common, which happens when a clot blocks an artery and fuel can't reach the cells, and hemorrhagic, in which an artery ruptures and bleeding damages brain tissue. With aging, the cerebral hardware becomes more sensitive to chemicals, and certain medications can act like viruses that overload the system to the point of silent failure. Among these are non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, naproxen, and diclofenac. Taken indiscriminately, especially by those over 60, they promote sodium and water retention, increase blood volume, and stiffen the arteries, in an effect akin to forcing water through a narrow, hardened hose, generating hypertension, the primary risk factor for stroke. Additionally, these medications compromise kidney function by damaging the body's natural filters and alter platelet balance, multiplying the risk of clots forming in inappropriate locations. At the same time, they accelerate atherosclerosis by facilitating the deposition of fatty and calcium plaques on arterial walls. This trio of parallel mechanisms creates a perfect storm that turns a common over-the-counter pain reliever into a saboteur of brain health. To minimize this risk, NSAID use should be limited to the shortest duration possible and always under medical supervision. For chronic pain, opt for alternatives such as controlled dose acetaminophen or explore non-pharmacological treatments, including physical therapy and myofascial release techniques. Maintaining cerebral vascular health also requires healthy lifestyle habits. A diet rich in fruits, vegetables, legumes, and whole grains helps reduce inflammatory markers and preserve arterial flexibility. Omega-3 sources, such as cold water fish, flaxseed, and chia seeds, offer protective effects by improving blood fluidity and modulating coagulation response. Also include potassium-rich foods like bananas and avocados to support electrolyte balance and lower blood pressure. Regular, moderate physical activity, such as brisk walking, swimming, or cycling for at least 30 minutes most days of the week, strengthens the arterial endothelium, reduces arterial stiffness, and enhances cardiovascular function. Resistance exercises with bands and light weights, combined with specific stretches, maintain vessel mobility and help prevent adhesions that can impede cerebral circulation. Quality sleep plays an equally important role in vessel regeneration and hormonal balance. Establish a rest routine by avoiding bright screens before bed and keeping your environment dark and cool, which promotes cellular repair and reduces the risk of vascular changes. Stress management techniques, such as guided meditation, deep breathing, or yoga, lower chronic cortisol production, a hormone that in excess contributes to systemic inflammation and endothelial dysfunction. We cannot fail to mention the importance of regular medical follow-up. Regularly measuring blood pressure, monitoring cholesterol and blood sugar levels, and evaluating kidney function allow for the early identification of changes that increase stroke risk. In patients who truly need long-term NSAID use, quarterly renal function tests and cardiological evaluations help adjust therapy before complications arise. Finally, discussing with your doctor the use of protective medications, such as statins for cholesterol control and antiplatelet agents in selected cases, can form part of an integrated prevention strategy. In this way, by combining informed choices about medications, diet, exercise, sleep, and stress management, you build a network of protection that keeps your brain highways free of blockages and your brain functioning at peak efficiency. Chronic use of non-steroidal anti-inflammatory drugs causes persistent inflammation in the arterial lining, eroding the inner walls like fine sandpaper that creates rough patches where cholesterol adheres and forms solid plaques. These plaques can break off and travel to the brain, blocking blood flow and triggering a stroke. Consider Carlos, age 68, a retiree who loved gardening but suffered from knee osteoarthritis. His daily solution was 2 diclofenac tablets. He did not realize that his already mildly elevated blood pressure was silently rising even higher as his arteries stiffened. One morning while watering the roses, he felt dizzy and could not raise his arm. The stroke, caused by a clot, found fertile ground cultivated by each daily dose of the anti-inflammatory. To reduce this risk, it is essential not to stop medication without medical guidance, but to start an honest dialogue. Ask your doctor whether a minimal dose of acetaminophen would suffice for pain relief, and consider the topical use of diclofenac or ibuprofen gels, which work locally without burdening the body. Physical therapy techniques, strengthening exercises, and heat and cold therapies offer safe alternatives that address the root cause without increasing vascular risk. Section 2, Anticholinergics pose a danger often underestimated and not widely associated with stroke. Indicated for urinary incontinence and overactive bladder under names such as oxybutynin, tolterodine, and sulfonation, they block acetylcholine, an essential neurotransmitter not only for bladder muscle control, but also for memory, learning, and cognitive function. These medications do not act exclusively on the bladder. They circulate throughout the body, reach the brain, and switch off synapses, causing mental confusion, learning resistance, and drowsiness. Beyond cognitive decline, anticholinergics interfere with the regulation of cerebral blood flow by preventing arteries from dilating when more oxygen is needed, creating low-flow areas that set the stage for a stroke. Symptoms such as dizziness upon standing and sedation further aggravate cardiovascular instability in older adults. Meet Marta, age 75, a widow and active woman who was prescribed oxybutynin to control episodes of urinary urgency. Initially relieved, she began to notice small memory lapses and difficulty concentrating. Unbeknownst to her, she was putting her brain at risk of insufficient blood flow and more severe cognitive decline. The safe strategy includes a rigorous review of these drugs' usage. Discuss with your doctor options, such as habit changes to train the pelvic floor, biofeedback exercises, and behavioral stimulation programs that reduce the need for anticholinergics. In cases where no alternative exists, consider lower doses and the shortest possible duration. To protect your brain on all fronts, adopt a diet rich in healthy fats such as omega-3 from cold water fish and chia seeds, which improve blood fluidity and fight inflammation, while also prioritizing berries and cruciferous vegetables that strengthen vascular integrity. Include potassium sources like avocado and banana to help regulate blood pressure. By engaging in regular moderate exercise, brisk walking, swimming, or cycling for at least 30 minutes most days, you stimulate arterial elasticity, reinforce muscle tone, and improve blood supply to the brain. Light resistance training and stretching exercises help maintain vascular flexibility and reduce tissue adhesions. A quality sleep routine with a dark environment and no artificial lights before bed enhances cellular repair and hormonal balance. Stress management techniques such as deep breathing, guided meditation, and yoga lower cortisol levels and protect the arterial endothelium. Periodic medical follow-up is the foundation of everything. Monitoring blood pressure, conducting renal function tests, and evaluating coagulation parameters ensure early therapeutic adjustments and minimize risks. In some cases, the strategic use of statins and antiplatelet agents always under supervision adds an extra layer of defense. By integrating medication review, healthy lifestyle habits, restorative sleep, and targeted exercise, you build a robust barrier against the silent risks of NSAIDs and anticholinergics, keeping your brain highways free of obstructions and preserving your autonomy and quality of life for many years. But over the months, Marta's daughters noticed her memory lapses occurring increasingly often. One morning, as she rose from the sofa, she experienced intense vertigo and collapsed. She had suffered a transient ischemic attack, a warning sign that a larger stroke was imminent. When physicians reviewed her medication list, the connection became clear. The drug that had restored her social independence was threatening her life. This episode is a wake-up call for anyone using anticholinergics. If you take medications for urinary incontinence or overactive bladder, check whether they belong to this class and seek your doctor's advice immediately. The fundamental question is, what is the impact of this medication on your brain, and what alternatives are available? Fortunately, safer options have emerged. Beta-3 agonists, such as mirabegron, act on specific bladder receptors without interfering with acetylcholine, preserving cognition and not increasing stroke risk. Additionally, behavioral rehabilitation and Kegel exercises to strengthen the pelvic floor have shown significant results in reducing urgency episodes. Bladder retraining through fixed voiding schedules and gradual elimination of diuretic substances like caffeine and alcohol can significantly reduce symptoms without exposing the brain to unnecessary risk. In the third section, we address systemic corticosteroids such as prednisone and dexamethasone, miracle drugs for allergic crises, asthma, and autoimmune diseases, but silent threats to the vascular system. Prolonged use promotes sodium retention and potassium loss, raising blood pressure more intensely than common NSAIDs. They also increase blood sugar, can induce steroid-induced diabetes, and accelerate arterial stiffness, causing vessel hardening and fragility. The third hazard of corticosteroids lies in altering the lipid profile, raising LDL cholesterol, and making blood more viscous and prone to coagulation. Jorge, a 72-year-old man with severe COPD, endured frequent prednisone cycles for each pulmonary flare, yet no tapering plan was established. Over time, he developed chronic hypertension, elevated glycemic levels, and advanced atherosclerotic plaques. One morning while reading, he noticed numbness on one side of his face, a clear sign of stroke. Prednisone wasn't the sole cause, but it hastened the path to disaster. Smart corticosteroid use demands the lowest effective dose for the shortest possible duration, with constant monitoring of blood pressure, glucose, and lipid levels. A thorough dialogue with your physician is essential to evaluate alternatives such as topical or inhaled corticosteroids for respiratory illnesses and disease-modifying anti-rheumatic drugs for arthritis. When systemic use is unavoidable, the protective plan must include a low-salt, low-sugar diet, strict control of blood pressure and glycemia, potassium supplementation, and renal function monitoring. To reinforce cerebral defense, incorporate habits like a diet rich in healthy fats, omega-3s found in cold water fish and chia seeds, which improve blood fluidity and fight inflammation. Eating cruciferous vegetables such as broccoli and kale strengthens enzymatic defenses and reduces oxidative stress in the vessels. Regular aerobic exercise accelerates cerebral circulation and nitric oxide production, which relaxes the arteries. Pelvic floor strengthening exercises and specific stretches help restore bladder function after medication discontinuation or surgery and serve to reduce anticholinergic dependence. A restorative sleep routine of 7 to 8 hours and stress management techniques such as meditation and diaphragmatic breathing lower chronic cortisol levels, a hormone which, in excess, contributes to continuous inflammation and endothelial dysfunction. Periodic clinical follow-up is indispensable. Regularly review lipid and glucose profiles, assess renal function, and monitor vital signs in quarterly checkups. Early adjustments reduce risks and strengthen preventive response. In selected cases and under strict guidance, consider the addition of statins and antiplatelet agents as therapy complements. You don't have to accept unnecessary risks when using antipsychotics in dementia. Reflect on every pill, speak candidly with your doctor, request evaluation of alternatives, and always put cerebral safety first. Remember that human care and a supportive environment are often more powerful than medication.